Welcome to the PCOS month. Hope you have watched our entire library of videos on PCOS. So today let's talk about a very distressing symptom of PCOS, the hair fall. Whether there are many loose strands in the shower, on the pillow or on the brush or a broadening parting line, this sight is not welcome by any woman. So today let's understand why hair loss occurs in PCOS and can you do something about this. So hello everyone, I'm Dr. Anjali Kumar. I bring greetings to you from Maitri. Maitri is a space where we talk anything and everything about women's health. So today I have an expert dermatologist, Dr. Seema Oberoi Lall, who is a senior consultant dermatologist with more than 20 years of experience in her field to give us 5 important tips for PCOS hair fall. So welcome Dr. Seema to Maitri.
Thank you, Dr. Anjali. It's an honor to be here at Maitri. In fact, I do ask a lot of my patients to look at tips on this channel, and I hope you find our hair loss tips, which we'll be discussing today, pretty helpful.
Thank you. So now, why does the hair fall occurs in PCOS? So it is strange that in PCOS we get excessive hair at wrong places and the hair fall from a place where we want good hair. So the hyperandrogenic state in PCOS, which is the excess male hormones in the body, this leads to male hair patterns in the body, which means more hair on the body and less hair at the scalp.
What happens exactly is that normally each root produces about 3 to 4 hair, which are nice and thick. But as this hair loss affects and the hair roots start getting thinner, so instead of let's say 4, you end up having 3, 2 or 1 hair, and eventually the root sort of gets destroyed. And each strand of hair gradually starts becoming very thin. And because of that thinness, it becomes dull, it becomes easily fragile, and it can break very easily. So in addition to this thing which is happening to your individual hair, the pattern is very typical, unlike males where you have a receding hairline, you can see a bald scalp here. God is kind with women, the hairline is usually intact, but what goes on wrong is in the crown area. That becomes thinner, the parting becomes wider.
So tell me, how much hair loss is normal? Like, how do I know that my hair fall is excessive?
That's a very important question, Dr. Anjali. In fact, about 50 to 100 hair are lost every day. That's normal. That's a part of a normal routine and constant renewal that happens every day. But anything more than about 50 to 100 hair, if they are lost every day, and on top of that, if you find that your hair look thin on your crown or anywhere when you're styling them, that's an important sign that something is going wrong. And till about 25% of your hair are lost, that's quite a big number. It may not be very obvious.
So let's talk about 5 tips to manage the hair loss of PCOS. Number 1, meet a gynecologist. So the gynecologist is going to take a detailed history, ask for certain investigations. The gynecologist is going to be asking you about your periods. Is your period regular? What is the flow of the period? Are you having any infertility issues? Are you having a weight gain problem? Then the doctor is going to be advising you certain investigations. We also do an ultrasound to check for the PCOD. So coming to the treatment by a gynecologist, we like to prescribe oral contraceptive pills. So how do these work is they basically reduce the amount of androgen levels in the body. We also might prescribe you certain anti-androgens, metformin, inositol. So it's important to meet a gynecologist. Next is meet a dermatologist. So tell me what a dermatologist is going to do now.
Yeah, so meeting This is equally important because not only do we take a history, a proper history as to where you started your hair fall, and also examine for any other issues that you may have, because PCOS, as we just discussed, is a syndrome. You may have acne, you may have excessive hair on your face and other body parts. And in addition, we also need to check with things like a dermoscopy examination. It's like a small microscope, a handheld microscope which we use to check your hair roots, where all the loss is there, what sort of a hair are growing there. In addition, we also like to examine your scalp health. For all we know, there might be some other skin issues sitting there. You know, there are a lot of hair losses which are not necessarily a patterned hair loss. There might be skin diseases like lichen planus and other scarring diseases which may be requiring some other different treatment. We would like to go for different treatment options that can involve different medications to eat. In addition, a lot of serums we have, which may range from things like minoxidil, growth peptides. We have excellent growth peptides, serum factors, growth factors. In fact, I would also like to mention about what we call as a PRP therapy. That's a platelet-rich plasma therapy that we refer to a lot of our patients. In addition, things like low-light lasers and eventually hair transplants can also be considered in some patients.
So there is a lot which can be done to restore your crowning glory. Okay, so then the third tip is the role of supplements. I always tell people the hair loss is that your hair are telling you, look, there is something internally wrong. Something needs to be done internally to restore the internal health.
See, I say that hair is like a protein, you know, and it grows pretty fast. Imagine when people shave, they get a little stubble the next very day. So what you eat and what goes onto your body is reflected onto your hair immediately. So you need those building blocks for your hair.
So tell me, should people be taking these supplements on their own, or it is important to visit a doctor? Just because my friend was using this supplement, it doesn't mean that this will work for me as well.
Well, through Maitri, I would like to make this suggestion to all of you that it's not a good idea to take supplements on your own. You never know, they may be harmful. There is something called as a hypervitaminosis also. So it's good to consult your doctor. You may need A while you may be eating B.
So in my experience also, I have seen anemia is one big reason for hair loss. I mean, you treat anemia and practically 50% of the patients do very well.
Very true.
One very, very important thing I want you to address is biotin really required, or is it a scam or a fad?
Well, sorry to say, but it is really a scam. Most of us, in fact, majority of us are not deficient in biotin. With a balanced diet, we do get it in our diet every day. So please stop popping them unnecessarily.
Yes, so very important. Biotin is not like the magic pill as it is marketed. Now coming to our tip number 4. So what can people do at home? So I want you to tell them, doable home care tips for the hair loss.
Excellent. So that's what you can do at home. First of all, learn to choose the right shampoos because they're going to wash your hair. A shampoo cannot grow back your hair, but a shampoo can wash them nicely. For people who've got very oily scalp, you may wash it frequently. You can use a milder shampoo most of the week and use a slightly stronger shampoo once or twice a week. For people who've got dry hair, can use a milder shampoo twice a week. That's my take. And don't comb them while they are wet because they are very thin and very fragile. Wait for them to air dry a bit and use a wide tooth comb or your fingers to comb them up. Avoid vigorous massaging or tying them very tightly into a tight ponytail. There is something called a traction alopecia where the temples, they sort of thin out the hair. Same goes for a lot of other things we do to our hair like blow drying. As far as possible, avoid it. But if your grooming needs it, then I guess use it on cold setting. Keep it about 6 inches away and as minimal as possible. These days, there are a lot of grooming damage, a lot of reasons for us women to damage our hair: straightening, ironing, rebonding, hair coloring, bleaching, and whatnot. All these things expose our hair and hair shaft specifically to a lot of chemical damage, extremely high temperatures, and all of them damage our hair shaft. And remember, when our hair shaft, the hair shaft is like a fiber sitting there. When it's damaged more than 50%, it can still manage about 50% of damage. When it's more than that, your hair becomes extremely fragile. And at that point of time, even a simple combing, tying them, or especially doing nothing, just sleeping on a pillow, can make you lose your hair. And most of the times you keep wondering, what is it that I did? So it's not what you did right now, it's what you've been doing with them over years, Even ironing your hair once in a week, you can imagine how many weeks are there in a year. And with long hair, you've had them for like 4 years, and how much of ironing? So that's probably damaged over years.
So tell me, Dr. Seema, honestly, is there anything called as a hair loss shampoo? The market is full of hair loss shampoo, hair breakage shampoo, hair rejuvenation shampoo, and so on. Is there any truth in that? I want you to give an honest answer.
Well, frankly speaking, there's nothing called a hair loss shampoo. The shampoos are supposed to do what they're supposed to, that is wash your hair. The only good part about choosing a shampoo is a shampoo which cleans your hair but doesn't strip off the excess moisture from your hair. But yes, there are certain shampoos which may have certain medicines added to them, like ketoconazole, ZPTO, selenium sulfide. These are the kind of shampoos which are used for certain clinical situations, maybe dandruff, psoriasis, and certain diseases, where they have a certain role to play, but not necessarily hair loss.
And they should be used only on the advice of a dermatologist.
True.
Mm-hmm. Tell me, I've been reading while I was researching for this that people use rice water for their hair growth. Is it a fad, or is there any truth in this?
See, most of these things don't get absorbed onto your roots. So our hair are not like plants that you put manure, you put water, you put oil, and everything gets absorbed. What you eat is what grows your hair.
Yes.
So what you apply is probably helping in conditioning, nothing beyond that.
Fifth tip, lifestyle changes. Now, this is one of the very important part of the hair loss treatment. The first thing is a well-balanced diet. A diet which is rich in protein, rich in antioxidants, good quality fats. For example, nuts and pumpkin seeds are rich in zinc. Beans and broccoli is rich in selenium. Rice is rich in silicon. Peanuts in biotin. And eggs and seafood in choline and other vitamin Bs. So make sure that your plate is as colorful as it can be. Very important, work on your weight. So we all know that PCOS is actually a symptom of a bigger problem which is known as insulin resistance. So make sure that you work on your weight loss. Make sure that you fall into a healthy BMI range. It is said that even 5% weight loss can bring good results in reducing your PCOS and then the symptoms of PCOS like hair loss, acne, and other things. Make sure that you're working on stress management, you're working on your sleep hygiene. So working on your stress and sleep brings down your cortisol levels, brings down the androgen levels, and hence indirectly would benefit you in your hair loss journey. So, is PCOS hair loss reversible? Yes. With a combined approach of good care, medications, and supplements, it is very much possible. So if you have been diagnosed with PCOS-related hair loss, I know it may feel really overwhelming and very depressing, but be patient. It may take 6 months to 1 year to see the results of hair treatment. Follow the treatments and lifestyle changes, not just until the first positive results are seen, but until your hair are completely restored. So big thank you to Dr. Seema for being here at Maitri and for such valuable inputs. And today, Like always, if you found today's video helpful, informative, do not forget to like, share and subscribe to Maitri, and we will see you soon.